Students, today we will discuss the axilla. In the diagram it is visible anterior axillary line, posterior axillary line, and it between these two lines this is the mid axillary line. Now this is the anterior fold of the axilla formed by the pectoralis major. This is the posterior fold of the axilla formed by latissimus dorsi. Now this axilla is a pyramidal space. It is located between the upper part of the arm and chest wall. It has apex, base and four walls, that is anterior, posterior, lateral and medial. Now coming to the apex, before that you should please see this diagram. This is the first rib, this is the scapula, this is the clavicle. So this apex is a truncated part which is directed upward and medially towards the root of the neck. So this portion is forming the root of the neck. Now this axilla is bounded anteriorly by the posterior surface of the clavicle, posteriorly by the superior border of the scapula, and medially by the outer border of the first rib. And this is an oblique passage which is given the name cervicoaxillary canal, through which the axillary artery, vein and brachial plexus they enter the axilla. Now base of the axilla is directed downward and it is formed by skin, superficial fascia and axillary fascia. Now coming to the different walls, it has four walls as we have discussed, that is the anterior wall. It is formed by pectoralis major, minor and clavipectoral fascia. Then it has posterior wall which is formed by subscapularis muscle, teres major and latissimus dorsi. Then it has medial wall which is formed by the upper four ribs with intercostal muscles and upper part of the serratus anterior. Then it has lateral wall which is formed by the upper part of the humerus along with the short head of the bicep brachii and the coracobrachialis. So these are the boundaries of the axilla. Now coming to the contents of the axilla, that is axillary artery and its branches, axillary vein and its tributaries, then part of brachial plexus, that is infraclavicular part, then 5 groups of axillary lymph nodes, then long thoracic nerve and intercostobrachial nerve, then axillary fat and areolar tissue. Now coming to the applied aspect of axilla, why axilla is important. Now this axilla has abundant axillary hair. The infection of hair follicle and sebaceous gland give rise to boils which are common in this area. So you can see, then examination of the axillary lymph node are important in clinical practice. So you should have the knowledge of the location of the different axillary group of lymph node. So this is the anterior group, this is the posterior group, this is the apical, this is central and this is the lateral group. So then is an abscess originating from cervical vertebra can track down to the axilla along the neurovascular bundle. So in deep cervical fascia is continuing in the upper limb for some distance as axillary sheath enclosing this neurovascular bundle. So that pus which is arising from the cervical vertebra can come down to the axilla. Now next is, while draining the abscess from axilla, incision is to be placed between the anterior and posterior margins closer to the chest wall to avoid injury to the neurovascular bundle. So when a question will come on the axilla, so you are supposed to write the different boundaries of axilla, that is it has apex, base and four walls. Then you are supposed to write the contents of the axilla and then is the applied aspect. So this is all about axilla. Thank you very much.